Hello, my name is Samantha Hira, and today I will be presenting on the allocation of scarce resources in healthcare. This topic has become especially relevant during global crises such as the COVID-19 pandemic, when hospitals and healthcare systems face unprecedented shortages of critical resources like ventilators, ICU beds, medications, and even trained healthcare personnel. While many people think of healthcare as being able to provide care to anyone who needs it, the reality is that resources are always limited. The pandemic brought this limitation into a sharp focus, creating ethical, legal, and moral dilemmas that healthcare professionals must navigate carefully. In this presentation, we will explore the major concepts, ethical principles, legal obligations, moral and Christian perspectives, and policy considerations surrounding the allocation of scarce resources. I will provide examples, case studies, and practical applications to help illustrate the complexity and importance of making fair, ethical, and legally compliant decisions in healthcare. By the end of this presentation, we should have a deeper understanding of how healthcare professionals navigate these challenging decisions and how ethical principles like beneficence, justice, and respect for persons guides these choices. So let's consider for a moment, if you were in a hospital during a crisis, how would you want these decisions to be made for you or your loved ones? Allocating scarce resources refers to the process of distributing limited healthcare resources fairly and ethically. Hospitals rarely have unlimited supplies or capacity, even under normal circumstances. For instance, operating rooms must be scheduled, specialty care must be prioritized, and staffing constraints may limit the number of patients who can be treated at any given time. During crises such as pandemics, natural disasters, or mass casualty events, these decisions become heightened and urgent, often having life or death consequences. During the COVID-19 pandemic, hospitals around the world were forced to make extremely difficult choices about which patients would receive ventilators, ICU beds, and critical medications when demand exceeded supply. These decisions raised important ethical, legal, and social questions. Who should be prioritized? How to ensure fairness? How to minimize harm? And how to protect vulnerable populations who may be disproportionately affected by scarcity? These questions are not purely theoretical. They have real consequences for patients, families, healthcare workers, and society as a whole. Throughout this presentation, we'll examine issues in depth, considering the principles, frameworks, and practical tools that healthcare professionals use to make ethically defensible and legally compliant decisions. Allocating scarce resources involves balancing three major considerations: fairness, equity, and efficiency. Fairness means that all patients are treated equally without bias based on gender, race, social status, or other personal characteristics. Equity ensures that those who are most disadvantaged or vulnerable, such as the elderly, the chronically ill, or individuals from socioeconomically marginalized communities, are appropriately prioritized so that healthcare systems do not exacerbate existing inequalities. Efficiency focuses on maximizing outcomes, such as saving the greatest number of lives or the greatest number of life years. These principles are interconnected, yet they often conflict in practice. For example, prioritizing younger or healthier patients may maximize survival and overall outcomes, reflecting efficiency, but it could be perceived as unfair or discriminatory towards older adults or those with chronic conditions. Similarly, prioritizing healthcare workers or essential personnel may increase overall societal benefits, but can also raise questions of fairness and equality. Hospitals often address these dilemmas by using structured triage protocols, scoring systems, and ethics committees, which provide guidance and oversight. By understanding these controversies, it helps healthcare professionals anticipate difficult decisions and make choices that are ethically defensible, socially responsible, and legally compliant. The complexity of these decisions highlights that there is no perfect answer, and every choice involves trade-offs that must be carefully considered and justified. So, how do we balance the needs of one patient against the needs of many? So for starters, ethical decision-making and resource allocation can be guided by core principles that provide a framework for navigating these difficult choices. The first principle is beneficence, which involves acting in the best interest of patients by maximizing benefits and minimizing harm. For instance, a triage system that prioritizes patients most likely to survive treatment demonstrates beneficence by ensuring that limited resources achieve the greatest positive impact. The second principle is justice, which emphasizes fairness and equity in resource distribution. Justice requires that allocation policies do not systematically disadvantage vulnerable populations and that all patients have an equal opportunity to receive necessary care. Marginalized communities should have equitable access to critical treatments, such as ventilators or vaccines, even in high-demand situations, and policies must account for social determinants of health to avoid reinforcing disparities. The third principle is respect for persons, which recognizes patient autonomy and dignity. Even during crises, patients should be informed about decisions affecting their care whenever possible, and their values should be taken into account in treatment planning. These principles often intersect with ethical theories. Utilitarianism, for instance, aligns with beneficence by focusing on maximizing positive outcomes for the greatest number of people. Deontology emphasizes respect for persons and moral duties, underscoring the importance of honoring patients' rights and autonomy. Social justice frameworks support equitable allocation, consistent with the principle of justice. By balancing these principles, it ensures that resource allocation decisions are ethically sound and socially responsible, even under extreme pressure. So, let's consider how difficult it must be to apply these frameworks in a chaotic, overwhelmed hospital setting. Let's consider a real-world scenario to illustrate the practical application of these principles. Imagine a hospital has a limited number of ICU beds but is facing an overwhelming influx of critically ill COVID-19 patients. To make a decision on who should receive care first, the hospital would likely rely on a triage scoring system that takes into account factors such as age, comorbidities, severity of illness, and probability of survival. Deciding which patients receive care requires balancing efficiency by aiming to save the most lives, justice by ensuring that decisions are fair and equitable, and respect for persons by considering patient dignity and, wherever possible, patient preferences. These decisions are ethically complex because every patient is valuable, and denying care has serious consequences, both medically and emotionally. Healthcare professionals depend on established protocols, ethics committees, and meticulous documentation to navigate these challenging scenarios. Reflecting on such examples helps illustrate the tension between theory and practice, showing how ethical principles are utilized in real-world, high-stakes situations. These scenarios reveal the psychological burden that healthcare workers face as they must make decisions that can profoundly affect the lives of patients and their families. Understanding the legal context is also critical for healthcare professionals making allocation decisions. The standard of care requires that medical professionals provide treatment that meets accepted professional standards, even during crises. Failure to adhere to these standards can result in legal consequences, including malpractice claims. During periods of resource shortage, healthcare professionals must document their decisions carefully, following hospital policies and applicable legal guidelines. For example, using triage scoring systems and consulting ethics committees can provide both ethical guidance and legal protection. Knowledge of the law helps professionals navigate the tension between ethical obligations and legal responsibilities, ensuring that their difficult allocation decisions are made with patient welfare and legal compliance in mind. Legal frameworks such as the Emergency Medical Treatment and Labor Act, also known as EMTALA, requires hospitals to provide emergency care regardless of the patient's ability to pay. This means that the financial status cannot determine who receives care in a crisis. State-specific triage guidelines also play a role by establishing protocols for crisis standards of care that protect healthcare providers from liability when followed appropriately. Professional liability is an important consideration. Clear documentation of the rationale for each decision, such as patient condition, triage scores, and consultations with ethics committees, is critical for transparency and legal protection. Informed consent may be difficult to obtain during emergencies, but wherever possible, patients or their families should be informed about decisions affecting care. By understanding these laws and obligations, it ensures that allocation decisions are both ethically and legally defensible. Think about how difficult it is to balance legal, ethical, and human considerations simultaneously. There are strong moral and ethical arguments both for and against strict allocation policies. Supporters argue that structured triage systems save more lives, protect public health, and use limited resources efficiently. Prioritizing patients most likely to survive or those who can benefit most from treatments maximizes the overall benefit to society, particularly in times of crisis. On the other hand, opponents raise concerns about fairness, potential discrimination, and the moral distress experienced by healthcare professionals forced to make these difficult choices. Policies that deprioritize older adults, chronically ill patients, or socially disadvantaged groups may be perceived as unjust or discriminatory. Some argue that allocation systems conflict with the principle of respect for persons by making value judgments about whose life is worth saving. Healthcare professionals must navigate these debates carefully, balancing competing ethics principles like beneficence, justice, and respect for persons. Engaging with ethics committees, soliciting public input, and maintaining transparent policies are different ways to make these decisions morally and socially defensible, even when choices are difficult and outcomes are uncertain. From a Christian perspective, ethical decisions about scarce resource allocation are guided by biblical principles. The sanctity of life teaches that every human life has intrinsic value, and this should be respected in all decisions, aligning closely with the principle of respect for persons. The command to love thy neighbor emphasizes caring for the vulnerable and marginalized. During crises, this might mean giving special consideration to patients who are socially disadvantaged or at a higher risk. Stewardship is another guiding principle, calling us to use resources responsibly and wisely. Limited resources should be allocated in a way that maximizes benefits while honoring moral obligations. Healthcare professionals guided by Christian values aim to balance fairness, compassion, and responsibility, ensuring that allocation decisions reflect both moral integrity and professional ethics. Integrating these values into clinical decision-making can help maintain the moral decisions of healthcare providers and ensure that the most vulnerable are protected during times of scarcity. Based on ethical principles, legal obligations, and practical experience, several policy recommendations can improve the allocation of scarce resources. Hospitals should develop transparent and ethically sound allocation protocols that are publicly available and clearly outline criteria for prioritization. Decision-making should involve ethics committees and public input to ensure policies are socially accountable and culturally sensitive. Hospitals can use simulation exercises and case studies to train staff in applying these protocols under pressure, which would allow healthcare professionals to practice making difficult decisions in a controlled environment. Ethics training is essential, helping professionals understand principles like beneficence, justice, and respect for persons, and how to apply them in real-time situations. Policies should also be regularly reviewed and updated to reflect new evidence, societal values, and legal requirements. Transparency, training, and continuous evaluation would help to maintain public trust and ensure allocation decisions are fair, ethical, and legally defensible, especially when resources are extremely limited and decisions carry profound consequences. In summary, the allocation of scarce resources in healthcare is a complex and ethically challenging issue. Professionals must balance competing principles, including beneficence, non-maleficence, justice, respect for persons, stewardship, and solidarity. Legal knowledge is essential to ensure compliance with standards such as EMTALA and state triage guidelines, as well as protecting against liability and documenting decision-making transparently. Christian perspectives help to remind us to value every life, care for the vulnerable, and exercise responsible stewardship. By combining ethical reasoning, legal understanding, and moral reflection, healthcare professionals can make decisions that are fair and transparent. Ultimately, the goal is to protect lives, promote public trust, and uphold professional and moral standards during times of resource scarcity, recognizing that every decision carries profound ethical and human significance. The challenges of allocation during crises highlight not only the limits of healthcare systems, but also the profound moral responsibilities entrusted to those who provide care. And they serve as a reminder that ethical, legal, and compassionate frameworks are essential for guiding difficult choices in medicine. And here are my references. Thank you.